Regular viewers of this channel will know that I have very recently started a new treatment, intermittent hypoxic hyperoxic therapy. Now this treatment essentially tricks your body into thinking that you are at high altitude, helps your body to create all of the various positive physiological adaptations that come with that, including increased red blood cells, better mitochondrial health, and a general capacity for your body to oxygenate itself better. Now, while there exist a range of anecdotal reports, both from patients with ME-CFS and Long Covid, as well as some doctors who work with them, there are not so many actual published research papers on the use of IHHT for these conditions. However, in today's video, I'm going to be talking about one paper published in 2024 which looked at the effects of 15 IHHT sessions on 70 patients with Long Covid. As you will see, the results were actually really encouraging. But first, my name is Patrick Usher and I am author of the book Understanding ME-CFS and Strategies for Healing, in which I break down some of the latest, most exciting research into ME-CFS and Long Covid, as well as talking about a range of treatment strategies that can improve quality of life. You can find links to that book as well as to a free sample chapter in the description box below. Now, for those who are completely new to intermittent hypoxic hyperoxic therapy, I suggest that you go to check out my recent video, now linked up above, which explains more of the foundations of it. But basically, as it is a therapy which is capable of helping your body to extract oxygen into the muscles better, of potentially producing red blood cells, of helping out with creating new mitochondria and improving cellular health, there is a strong rationale for why it could help with an illness like ME-CFS or Long Covid. But a rationale is one thing and objective data is another. And so what we're going to be looking at today is a paper from Germany, Intermittent Hypoxic Hyperoxic Training During Inpatient Rehabilitation Improves Exercise Capacity and Functional Outcome in Patients with Long Covid, Results of a Controlled Clinical Pilot Trial. This was work done by a group at the Charité University in Berlin and also at the Flechtingen Hospital where these patients were. And so what this study did is it had 145 patients altogether. 70 of them were put into the active arm, which involved being treated with the intermittent hypoxic hyperoxic therapy, and the other 75 patients were given a kind of standard rehabilitation, including breathing exercises, strength and endurance training, relaxation techniques, and occupational therapy and general counselling. Now, the first group, the IHHT group, was also given this standard therapy. So basically, both groups had the standard therapy and one group also had IHHT. So the group with the IHHT had 3 treatments a week for 5 weeks, for a total of 15 treatments. And each therapy lasted around 45 minutes and would consist of alternating between breathing hypoxic air and hyperoxic air between 6 to 8 times. And so typically for 5 minutes, patients would breathe hypoxic air, and that is to say low oxygen air at a dose of around 10 to 12% oxygen. Remember, the normal oxygen concentration in the atmosphere is 21%. So if you're breathing at 10 to 12%, you have gone to between 4,500 to 5,500 meters altitude. So you're basically like up on Mount Kilimanjaro. And then in a recovery period for around 3 minutes, they would breathe 30 to 35% hyperoxic air. And they'd have this kind of cycle 6 to 8 times during a typical treatment session. But what were the outcomes that this study was looking for in order to see whether or not this therapy actually works? And there were a range of things looked at: blood tests, various objective physical tests, and also subjective questionnaires. But for this video, I'm going to pick out 4 objective physical tests that were used and 1 subjective health questionnaire. So the 4 objective tests were the 6-minute walk time, stair-climbing capacity, the Borg dyspnea scale, so a scale to measure breathlessness, handgrip strength, and then for the subjective measurements, I'm going to talk about the fatigue assessment scale. So all of these had really interesting results, were noted as being important in the paper, and I'm going to now talk about each one of them in turn and what they tell us about the potential usefulness of this therapy. So first of all, the 6-minute walk time. Now this is basically just how many meters you can walk in a 6-minute period. And it's considered to be a very useful test for understanding the impact of various therapies on patients who have, for whatever reason, due to their health problems, lost physical stamina. And so what the authors of the paper point out, the primary endpoint of change in walking distance in the 6-minute walk test represents a robust and validated test and clinically highly meaningful measurement in patients with impaired functional capacity. An improved walking difference of more than 35 meters is considered the threshold to demonstrate clinically meaningful improved walking capacity in patients with cardiopulmonary diseases such as heart failure or pulmonary hypertension. And so what was interesting is that the IHHT group in this study actually far outdid the kind of standard clinical threshold for significant improvement, in that they actually improved by 92 meters over the course of the therapy. And here we can see a graph showing their improvement. So they went from being able to walk for around 350 meters before treatment to well over 440 meters after the treatment. You see that the control group also improved, but only by about 32 meters, and actually they had a better starting baseline. If the IHHT group had a better starting baseline, perhaps their improvement would have been, upwards of 500 meters or more. But what this basically shows is that the level of improvement in the IHHT group was much more significant, and that's even more impressive given that it was coming from a lower starting point. The second objective measurement that I wanted to pick out is the stair-climbing capacity. Now in this case it's actually measured in terms of how many seconds it takes to climb a flight of stairs. And so what we see here is again a much more noticeable improvement in the IHHT group in comparison to the control group. And so the IHHT group started at 10.5 seconds to climb the stairs, but after treatment could climb them in 8.5 seconds, while the control group started at 10.5 seconds as well and only improved by half a second. For me as an ME patient, stairs are my constant nemesis. I find them very difficult, and I basically quite often actually have to rest every step or every second step in order to get up the stairs more safely, because if I just walk up them normally, I'm at risk of crashing myself. So the fact that this therapy can actually potentially help patients to work better in response to gravity and its challenges is for me something highly encouraging, that it will be changing something in a significant way. The third objective outcome was the Borg dyspnea scale, so again measuring breathlessness. What we see here is an improvement in both groups, but again a much more significant improvement, hypoxic-hyperoxic group, going from around 3.5 to 1.75 in terms of reduced breathlessness. And now we come to the fourth and final objective measurement, which is hand grip strength. Hand grip strength is actually very important in the context of ME-CFS research. It's often been used to measure patients' capacity in studies, and it's actually considered a very good marker for where people are at with the disease, because the more affected your mitochondria are, the more affected your cells are, the weaker your hand grip strength. And this is a key component of the Wirth and Scheibenbogen ME-CFS unifying model that I often talk about on this channel. And for them, the higher your intracellular sodium concentration, the weaker your hand grip strength. Something that I might do a video about in more detail some other time. And I believe you can actually buy the devices to measure your hand grip strength at home. It's called a dynamometer. But basically, it's measured in kilograms, and if you're healthy, you would expect the score to be over 32, 33 kilograms. If you have mild to moderate ME-CFS, you might expect something like 26 to 29 kilograms, whereas if you have severe ME-CFS, you would expect kind of less than 23. Therefore, it's interesting to look at this study and see, did patients, what was their starting hand grip strength, and did it improve? Because that would indicate that at a more cellular and mitochondrial level, there was also healing that occurred because of the therapy. And so in this case, we see on the left here, the people in the IHHT group, their starting hand grip strength was in the right hand 26.2 kilograms and in the left 24.9. So This is putting them very much into the kind of moderate ME-CFS category. And we can see that in both cases there was something of an improvement, not a dramatic one, but something of an improvement, going to 27.4 in the right hand and 26.3 in the left. Meanwhile, the control group, which is over on the right, had something of an improvement, but it was about kind of half or less than half of what was seen in the IHHT group. So this suggests that there is something of an improvement at a cellular and mitochondrial level from this therapy. And finally, in terms of outcomes from this study, I want to focus on the fatigue assessment scale which participants did before and after. Now, this is a scale that operates from 0 to 50, with 50 being the worst, and it's often used in studies for a wide variety of conditions. It's not specific to ME-CFS, although it's often used in relation to it. There are 10 questions which are asking about various things to do with energy and daily life capacity and so on. And if you have a score over 35, you're considered to have severe fatigue. And if you have a score between 22 and 34, it's considered mild to moderate. And if you have less than 22, you're considered to actually fall into kind of where the general population is. And so in this case, the results were actually really interesting. The IHHT group started with a score of almost 40 and then reduced down to 30. So they actually went out of the kind of severe fatigue down to mild to moderate. Whereas the control group, actually their fatigue got worse over the course of the treatment. And so they were just doing that standard kind of breath work and strength and endurance. They actually, their condition actually declined. So that's interesting because it tells us that the IHHT, which remember that group is also doing the strength and endurance training, etc., that they were actually, this therapy actually gave them a kind of bridge or a way of meeting the challenge of that physical activity, which the control group simply did not have. And that ties in with how I'm conceiving of this kind of therapy in principle, which is that it could well change someone's baseline stamina and capacity threshold so as to allow them to do more safely. This video is sponsored by Normalite. Now, I have been using Normalite for 3 years, and it is the most helpful supplement that I have found in managing my own condition. Like a lot of ME-CFS patients, I suffer with low blood volume, and Normalite is a highly effective strategy for combating this issue. It is a form of oral rehydration solution, and one study by Meadow et al. From 2019 found that this kind of formulation can boost blood volume as effectively as a saline IV. When I drink Normalite, I really notice the difference. I can feel the blood volume expanding throughout my body, my legs become lighter, my nervous system calms down. Even better is that Normalite has been specifically created for patients with illnesses like ME-CFS, Long Covid and POTS. So check out the link below to order your own bags of Normalite. I personally enjoy the pure flavour, but it does come in a range of options. Okay, so those were the primary objective measurements that showed positive change as a result of this study, and indeed the general conclusion of the researchers is that this is actually quite a promising treatment. They concluded intermittent hypoxic-hyperoxic training in patients with long COVID and severely impaired functional capacity has been shown to improve functional capacity, health-related quality of life, and objective and subjective symptomatic status. IHHT has been demonstrated to be safe, well tolerated, and feasible to be integrated in a hospitalised interdisciplinary rehabilitation programme to improve outcome after long COVID. Beneficial effects on measures of cardiovascular function and metabolism are promising. Therapeutic benefit of IHHT in patients with long COVID warrants further validation in a controlled clinical study. And that seems to be a fair conclusion that actually this is a therapy which has promise for changing someone's baseline functionality and health with these conditions. And that's very much how I'm looking at it. I don't think that this is a therapy that in and of itself is going to magically help someone to heal from ME-CFS or long COVID. It could be a bridge towards healing, even potentially on its own, or in conjunction with other therapies. And what I mean by that is, I see ME-CFS as an illness that's being weighed down by many different anchors. And because of that, the body is kind of stuck. It can't move forward, it can't spiral upwards, because these anchors can actually bring it down from many different angles. But if you had a therapy or series of therapies that could allow some of those anchors to lift, and you eventually get to a point where the kind of balance of strength between the anchors and the boat goes in favour of the boat, then it could actually lift up those remaining anchors itself and depart as the body actually spiral upwards towards health, because suddenly it doesn't have so many burdens being placed upon it. And so I potentially view IHHT as being a treatment that can lift some of those anchors. Maybe it won't be enough on its own. Maybe it will just help improve quality of life, and that's a good thing. Or maybe it could be enough on its own, given a particular patient's circumstances, to actually lift up enough anchors that the body then has the resources to do the rest of the job itself. And even if it doesn't help someone to heal, at the very least, it could help someone have a greater exercise capacity for daily life, be able to engage in more things without payback, and just help someone to manage their life better. And that too is a good thing. Now, we need to talk about a couple of other things arising from this trial. The first is that it was only 15 sessions, which is not a lot when it comes to IHHT, because from what I've seen from watching experts like Dr. Arkady, the first 10 sessions is really when the body's actually adapting to the therapy. Because this is a process of adaptation. It's a process of actual stress. It's an hypoxic stress. So, if someone goes to live at high altitude, it's initially stressful because the body has to work out how to still oxygenate itself, and it's receiving less oxygen from the environment. In essence, the kind of more beneficial impact of this therapy was really probably only coming in the last 2 weeks. And when I listen to someone like Dr. Prokopov, he says that a real treatment course for this is really more like 6 to 8 months, because that's when the benefits really, accumulate much more strongly over time. And so I think a much more helpful study to really get to grips with how useful this therapy may or may not be would be to actually study people for that length of time and see what happens. And a second important point in relation to this study is that the authors of this study state elsewhere that no ME-CFS patients were involved in this study. It was only long COVID patients. I don't know how they went about kind of establishing that. And the actual study itself took place between 2021 and 2022. And, there's a lot of confusion that exists among the medical profession, who sometimes make the mistake of thinking that, long COVID is entirely its own thing and it's unrelated to ME-CFS. And that could genuinely be a mistake here. And, when I look at some of the data from this study, particularly the handgrip strength, where people had a handgrip strength that was perfectly in accordance with what you would expect to see in ME-CFS, I would actually, question potentially whether or not these patients also had ME-CFS. On the other hand, researchers do distinguish between long COVID and ME-CFS, or at least they suggest that some people have just long COVID, but then some people go on to develop the most severe form of long COVID, i.e. post-COVID ME-CFS. So there can be a kind of cut-off point between where someone just has long COVID and when they actually go into post-COVID ME-CFS. And for some researchers, like Wirth and Scheibenbogen, when someone only has long COVID, it's characterized by hypoperfusion, this reduced blood perfusion, but not for as many reasons as occur in ME-CFS. So it would be more like just the microclots or the endothelial damage. And that might create fatigue and problems with quality of life, but those patients wouldn't experience post-exertional malaise. Whereas when you actually get ME-CFS, you are prone to having PEM and crashes and all of the kind of, even greater perfusion disturbances and muscular cellular disturbances that occur at that level. I'm just raising that in that the authors of this study, from their perspective, did not include ME-CFS patients. I, however, do wonder if they did, given the handgrip strength scores, given the fact that they were also described as having debilitating long COVID syndrome in the paper. But that's not something that we can actually answer. And so, in short, this paper may have only been studying people with pure long COVID kind of the circulatory disturbances and more maybe like lung damage or lung and respiratory problems, which certainly were recorded in this study. Or it may have also been studying ME-CFS patients or some ME-CFS patients. We don't actually know the answer to that. Nevertheless, it's still a very interesting study for people who have these kinds of conditions. I think it's a potentially, encouraging line of research that could be done in more detail in the future, as indeed the authors of this paper call for. And I think it's something to follow. For me, at the moment, I've just done the 5 treatment sessions, and so far I'm just in the adaptive phase. and the reactions to the treatment are getting easier. But I hope to update you all on how I'm doing in a few weeks or maybe a month or so as to how the therapy has actually been going. Anyway, that's it for this video. Please check out my recently launched Patreon Discord community for research and treatment support, where we have a private Discord forum. People can share strategies to help each other move forward. We have once a month Zoom calls. There's chances to ask myself questions there, also in the forum, chances to pitch questions for Q&A videos that I'm going to be doing. Check out the links for that down below. It's only €5.50 or $7 a month, and hope to see you there. And that's all for today's video. I will see you in the next one.